injection videos we've done in the past. I've demonstrated Restylane lip injections and Juvederm lip injections. Today we're going to introduce the Juvederm XC, which is an exciting new filler. Essentially it's Juvederm with lidocaine, making it much more comfortable, especially for lip injections, which in the past we've had to do dental block to make it comfortable for patients. But with Juvederm XC, we can actually do the injection without dental block, without the numbness feeling that lingers for about 2 or 3 hours, and some patients don't prefer that. We have a beautiful model that we've been working with her before on her lips, and she's here today for her Juvederm injection. And today we're going to do the Juvederm XC. It's the first time for her, and we're going to be able to see whether she can tolerate it without any numbing.
Hello.
As you can see, it comes in a sterile package, and we open the package. It's very similar to Juvederm in the past. It's a sterile needle. Now, some of you have asked me before on the videos whether the procedure is sterile. By definition, anything that's done around the mouth, around the nose, cannot be sterile because you cannot sterilize the lips and the nose completely. There are orifices and there's plenty of bacteria there. But the vial itself, the substance itself, is sterile, and we use it only one time. Each patient gets their own. What I like to do is start with a little alcohol wipe. And what I just do is just treat the lips, taking off a little bit of the bacterial load. Luckily, the face and the lip is so vascular that infections are almost unheard of. They can occur, but they're extremely rare. What we're going to do is start with a 30 gauge needle, which is one of the smallest needles you can get. The substance, as you can see, is a clear gel. And we're going to start from one corner and progressively move across the lip. What this does is every single injection is done in the previous zone where it was numbed up to begin with. So it makes it more comfortable. Now the first stick you'll feel, but after that it should be more comfortable. Ready?
Yes.
What I do is I roll the lip back a little bit with my hand and penetrate slowly. And then I fill as I'm penetrating. That does two things. It introduces the lidocaine into the zone, but more importantly, it pushes any small blood vessels out of the way. So the injection results in less bleeding and bruising, although again, bleeding and bruising can happen. The lips are very vascular. I'm sure it's not painless, but she's tolerating it very well. If your patient doesn't attack you or swing at you, that's a good sign.
It's great. It's really comfortable.
Good. Keep going. Back in the same zone again. Now, lip fullness and lip size is a matter of preference. Some people like 1, some people like 2, some people like 3 syringes to the lips. Our patient here is a professional model, so more exotic features are more desirable to her and her profession. But every patient has their own preference. And while this is a 1 cc syringe of Juvederm Ultra, there are even half cc syringes where some patients go for just a subtle improvement. Barely any bleeding. And the beauty of the lidocaine and the Juvederm Ultra XC is that now the upper lip is essentially numb. So you can go back and fine tune and it won't be as painful. Now we're going to start with the bottom lip again. You're going to feel this one. Pain obviously is subjective. But you can see that this is very bearable. At this point, I'll massage the substance in to make sure there's no lumps or bumps. Then I step back, look at the results, and go back and fine tune. And when I'm doing the fine tuning, it's a little different technique. It's a precise pocket point injection. She likes to have the upper lip full.
Not critically. I told her since I met her, she's like, you guys already know it.
She lets me go. And we're done. Now, it's going to appear a little bruised, it's going to appear a little lumpy bumpy for a few days, but that's the injection swelling around each injection site. That goes down in the first 2 or 3 or 4 days. You can cover with makeup, you can actually put lipstick immediately after oozing stops, which takes about 10 or 15 minutes for that to happen. I recommend ice at this point, but then by this afternoon she's ready to put on lipstick and go out.
Till I come.